Yes, so this is topic that I selected because I think that everybody would like to be prettier and younger, even there in the mid age or the late ages. So so people think that we are aging, and then there is no way that we can delay or reverse our aging process in your appearance. But if we now, yes, there is a way that we can delay the appearance and the process of aging with a different technique of the treatments. So that's why I told you enhancing beauty with a minimal invasion. And okay, so we just go a bit of an overview. So why the aging process happens. So what happened in our facial structures and the collagen and the elastin and the other ligaments. So in aging, that it weakens the facial support structures and it loses the fat, especially the connective tissue structures, the ligaments, and then it loses the elasticity and the collagen amount in our dermal area. So that causes the sagginess of the skin and develop wrinkles and the fine lines. So it affected includes mainly in the cheeks, around the eye, the neck, and the jaw. So we have seeing these pictures, you can see in the youth there is the firm, the tough skin will become more looser and saggy. So the face becomes square instead of the V shape. So we all see if our pictures in our young ages when you're doing your O levels and A levels and the initial stages of your university and the pictures of now, and you will see the difference. So that is because of the natural aging process. Okay, so I'm talking today. So how we delay or reduce these appearances. Again the pictures it become the inverted triangle become the triangle during your ages. It again became the ligament laxity support, laxity of the supportive structures and loss of elastin, collagen, and the hyaluronic acid content of your the skin and the other subdermal structures. So how to address these problems? There are three ways. There are three ways that we can address these problems. Number one is non-invasive. So there is no invasion. Invasion means there is no penetration of the skin. So there are non-invasive techniques, cosmetic surgical. It can be a medical, it can be non-medical as well, that we can enhance or support the building of the collagen and the elastin and these structures. And there are minimally invasive aesthetic and cosmetic medical procedures. These are medical procedures, and there is some invasion through the skin. So there can be injectables. And there is an invasive plastic and cosmetic surgical practice. They are pure surgical the techniques. Okay, so I'm touching the three topics in superficial in the broader manner without going much details to give you a bit of a more wider knowledge of these structure, these procedures that you can have an idea about it. So, it is considering the non-invasive, the anti-aging, the treatments that we can offer, or that we have access to, the chemical peels. So, I'm telling you the later what how it was done. So that we use a different type of chemicals. It can be acid, can be the bases uh, to clear the skin as well as stimulate the subdermal collagen levels. And there's a microneedling, and in the dermabrasion there is we call it a minimum the damage to the dermal area which stimulate the collagen again. And there is a light-based energy devices which is a laser. The laser is a light energy, so it can have a carbon dioxide laser, erbium laser, NDF lasers. Again, fire through the skin. Again, tighten up the facial tissues. The radio frequency again, the energy device or the energy which again used in the different ways can be a superficial or can be a micro needles or passing the needles to again to stimulate the thing. So it's a radio frequency and the HIFU. HIFU is a high frequency ultrasound. So ultrasound energy also can be used to tighten up the tissues. Then the plasmapine, again, another type of an energy devices. So using the chemicals and the mechanical and the light energy, that we can address the the problems that uh, I can show you in the earlier, right? And then going beyond these minimal non-invasive thing, there is a minimally invasive thing that we can penetrate the skin. So it is a botulinum toxin. We can use a botulinum toxin. It is used away the vast amount of clinical and the cosmetic procedures. So in the world, the botulinum toxin is the number one injectable in the anti-aging procedures. And the dermal fillers and the threads, fat injections, and the lipolysis treatment. So these are, I'm telling you, this is a topic that the broad frame that I will tell you later. So what are the treatments are? So these are the innovation which is commonly used: the toxins, the fillers, threads, fat, and the lipolysis. And what are the invasive? These are pure plastic surgery. So you can do it use a knife and do in the theater. Can be the facelift, brow lift, different type of corrections. So these are complex surgeries and they be long lasting and it is non-reversible. So the thing is in the non-invasive, the minimal invasive and invasive, the minimal invasive things are reversible. So we inject the Botox, the action goes wear off after about 6 months, so it can be back to normal. We inject the filler will resolve within 1 year, 1.5 years, and be back to normal. Or we can use the enzymatic process. We can dissolve the filler if it doesn't like the effect. So surgical surgeries are not. It's a non-reversible, but it's long lasting. If you do the filler, it lasts for about 1 year, but if you do the surgery, it's long lasting. You go back to the non-invasive pills. So we use the different type of acids. So these are the common acids that are used in the hospital procedures: the glycolic, salicylic, lactic, acylic, trichloroacetic, phenol, retinol. So these are the things that we can use in the different indications. We have the pigmentation issues, and if you have the fine lines and wrinkles, and if you have acne and the acne scars and the acne prone skin, to control these things, we can use the procedure. Other than the using the pure medical thing like the creams and the gels and the things, uh, you can use the procedures to give more enhance the medical management, especially in the cosmetic dermatology. So the peels will lighten up the skin. It controls the acne and controls the pigmentation, and again it stimulates the collagen. It gives you a tighter and the firmer skin if you're repeatedly uh, using these treatments. But the thing is, some people think one treatment is enough for everything. There is no magic one treatment. So there is a process that you need a multiple treatments in the desired intervals. And the laser. Again, the laser is a light energy. We use is very safe in the experienced hands. I'll tell you, the laser is a very safe in experienced hands, right? Otherwise, you can have a lot of problems if you do the laser in the wrong energy settings. So lasers can be used for the permanent hair reduction. We have the especially in the female, we have a hirsutism, and we want to shave your facial hair or the wax your facial hair. But you can use the lasers to get the permanent to remove the or permanent reduce your facial hair or the body hair. And the lasers can be used for the acne and the acne scars, the stretch marks, the pigmentation problems, especially the melasma, water pigmentation. The tattoo removal, if you want to have an unwanted tattoo to be removed. Sometimes I lot of get the they are not patients actually. We share their clients. They can be somebody's name in their body with a tattoo. But if you want to change that name, sometimes there is a way that we can remove with a laser. Or you can the vascular lesions like hemangiomas, spider veins, you can use the laser. Again, the fine lines and wrinkles, skin lightening, and the skin tattooing. If you have If you want to light and tone your skin, then again the laser, the toning can be used. So these are the common the problems that we use the uh, lasers in the cosmetic industry or the cosmetic procedures. These are some pictures. We can lighten up your dark lips with the laser, and we can get your shiny and brighter skin like in the carbon peel. I'll tell you some pictures, and you can reduce your acne scars and other scars with the laser, and the hair reduction and the stretch marks. Right. Okay. So here with the other one. So the chemical peels and the laser peels, there are difference. The peel means you're peeling off the superficial layers of the skin, like the dead epidermal layer. So it can be used the chemicals or the lasers to do these peels. The advantages is the chemical peel. You have a slow thing. You have multiple sessions. One in the laser that you can use like a deep peel at the one go. So you prepare the skin for the peel, and then we apply the acids that I told you earlier in the different strengths. If you use the glycolic acid, it's about 35%, 50%, 70%, depending on the skin condition. And we leave the acids for about desired number of minutes, depending on the situation, and then we neutralize the skin. So this is like a controlled chemical burn. So we use the acids to get the control chemical burn to stimulate the collagen and the thing. So there is a physiology underneath. That's why it should be used in a very safe hands. Otherwise, you will end up with the acid burn in the face. Yeah. So this is again the carbon peel. So what we do is we apply a medicated carbon in the face. So that is incorporated into the epidermal structure or the epidermal layer. So with the laser, we burst out the carbon. So with that carbon, the superficial layers of the skin will be peeled off. So this is the carbon peel. Again, there is a name which is called the Hollywood peel that people will do in the celebrities before their corporate events. So usually we do in the country before their weddings or some kind of a special event. They can use a carbon peel to get the instant brightness and the clearance of the skin. So there is the deeper. You all know about the facials, right? So in the salon they do the facial. So without scrubbing and damaging the skin, we can use the carbon peel to instantly clean off the skin without much damage. Again, the laser can be used to get the scar. This is carbon dioxide laser firing in my company. So this is the for the basically the active scars. You can use the VM and the carbon dioxide. Uh, so it's a bit painful, but we apply the numbing cream, so the Amila before the treatment. So again, you need the multiple sessions in the desired different intervals depending on the clinical situation. So the before and after pictures of the cheek scars, the acne scars after the about 2 or 3 sessions of carbon dioxide laser. Other thing is the laser can be used for the nail fungal infections. And it's a very resistant to medical and the topical treatment for the nail fungus. It's very resistant, it's very difficult. You go for antifungus, it will give a toxicity, give a long term of antifungus. But the laser can be fired. The long pulse NDF laser is used to get rid of the nail fungus. So in this case, we need multiple sessions in the different intervals to control the fungus. So all other fungal infections, sometimes these Peradeniya infections, you can use the lasers if you are not responding to the medical management. The tattoo removal. With the different types of intervals, you can just peel off the tattoo. Right. So then we move into the invasive, minimally invasive things. I think we all heard about these, the PRP or the platelet-rich plasma. It will be used in many specialties with the different clinical problems. So in the cosmetic surgery or the cosmetic medicine, we use a PRP or the platelet-rich plasma for the different indications. It reduces the fine lines and wrinkles. So we inject the PRP in the subdermal layers and enhance the texture, and it's tighten up the skin and the dermal structures. So we can use the microneedling pen to inject the PRP into the dermal structures, and it generates the new collagen and the elastin fibers again. And for the hair, we use a PRP to enhance the hair growth and reduce the hair fall. So especially in the androgenic alopecia, you can use a PRP to reduce the hair fall as well. And again, we use a PRP for the erectile dysfunction. We call the P shot. That it stimulates the corporal tissues and which increase the more blood circulation and reduces the fibrosis by regeneration. Minimally or the non-invasive body sculpturing technique, which is called the fat freeze and the cold sculpture. Again, is a machine that freezes the fat within the body using about -6 for about 45 minutes to 1 hour, depending on the situation. And there's a autolysis of the fat cells by crystallization. So which need the multiple sessions. You can combine the radio frequency to tighten up. If you reduce the amount of fat, there is a loose skin. So that loose skin can be tightened up with the radio frequency. So they have a multiple parallel sessions. So these are the basic, the minimally, the non-invasive treatments that we can use in the body and the face. Then we move on to the injectables. Yeah. The commonly used, the widely used in the globe is the botulinum toxin in the cosmetic industry. It's a huge part. So it's a botulinum toxin A. The brand came like a Botox, which is a neuromuscular blocker caused by the Clostridium botulinum. So that is to be used in the controlled manner to just relaxes or the paralyzes the facial muscles. Okay. So what happens is that each time we use the facial muscle, our skin and the dermis make lines and furrows. Okay. You just frown yourself and see you have the lines in your the glabellar region. If you raise your eyebrow, there's lines in your the forehead. If you tighten the eyes, there's lines around the eye. We call the crow's feet, glabellar lines, forehead lines, right? So if you are continuously practicing these, using these muscles, there is a firm line or the creases developing. Why? Because in the young age, you have a lot of elastin fibers in the tissue, so it recoils back. So if you frequently frown, it recoils back. But when your age, there's a recoiling power is reduced, so it can have a permanent line. So if you're a person like you always angry and you're frowning, so these muscles are developed more and their lines are more, right? So you're always happy and the things, so these lines are less. Right. Anyway, but there is the treatment for that. So you can use the Botox to just to paralyze, so they relaxes the lines underneath. So there is no more lines, right? So the Botox can be used for softening the forehead lines, relaxes the lines around the eye. We call the crow's feet, and the smile lines and the glabellar lines. So different. We can use a different strength of number of units in the different areas of the face. So the Botox will last for about 4 to 6 months depending on your habits. If you are frequently do a lot of activities, going to the gym and in exercises, the Botox weans off faster. If you're doing a lot of alcohol, the Botox weans off faster. But otherwise, it lasts for about 6 months. Right. So let's see how the Botox is done. So this is Botox we do for the face, the muscles in the glabella, the posteriors and the corrugators. So if you have these brow ptosis or your brows become more low, you can relax this and you got the brow up. So it can be a bit more open your eyes. You can have a bit of a younger looks without the tired look. And we do the Botox for the forehead, for the forehead lines. These are the subdermal injections. You just inject under the dermis, not to the muscles. You slowly penetrate to the muscle and then get the action. Okay, so the uses of Botox. The Botox can be used for the gummy smile. Gummy smile means if some people are smiling, they can show you the gums of the upper teeth, which is not aesthetically pleasing. So we have a reduce your lip length. We can use the Botox. So it's Botox for the gummy smile. And again, the Botox can be used for slim the face. Okay, if you have the broader face, uh, oh, especially if you have the parotid swelling, if you have a use in alcohol and use the parotid swelling, we use the Botox for the parotid and the masseter muscle to just to shrink the face or reduce the width of the face, so the face slimming. Yeah, there is some pictures, not mine, but uses for the Botox. The one is for the frontal lines, and the number two is for the glabella. If you want to have a reduce low set brows, especially in the ladies, if you want to get the brow up, you can lift the brow with the Botox. Again, we can smoothen out the lines around the eye with the Botox. Again, the gummy smile. So this is not only for the females, you can use it for the males as well to smoothen out the forehead and reduce the fine lines. It gives more younger appearance, right? So what are the complications can be developed with the bruising? There is very rare reported cases of the Botox allergy, but it is usually not. So it's very safe in the experienced hands. Can be a little bit of bruising, swelling, redness in the area. Sometimes we have no action. No action means sometimes because the Botox should be made in the cold chain. If you not maintain the cold chain, there will be no action. It can be incomplete action or can be asymmetry. If you do the two sides of the face, your doses and the injection points will be different. If change, sometimes there can be a asymmetry. Sometimes the Botox can go wrong if you're injecting the Botox to the upper face. Sometimes, other than in here, there is a ptosis. So we get the Botox to the glabella. Sometimes it will leak into the elevator and can be ptosis. Sometimes can be incomplete. Can't smile because there's too much of Botox. And if there's no symmetry, it can be a one brow up, which is called the spooky brow. Or sometimes you do the wrong injection points, can be a deep asymmetry. So that can be also corrected. So what are the other uses of Botox? You can use the Botox for acne vulgaris. If you have an uncontrolled acne for the medical management, you can use the Botox. And then the mesobotox is for smoothing out the skin. If you have very oily, rough skin, if you want to get especially these are the short acting, the mesobotox acts for about 2 weeks. We have a wedding or something like a event that you want to have the makeup, but you have a lot of oily and creepy skin. But use a mesobotox to reduce the oil secretion and smoothen out the skin texture, so your makeup artist can do a nice work on. It's like you preparing the skin like a canvas to get the artist to draw. You can use the Botox for the hyperhidrosis or excessive sweating. In the facial spasms, the blepharospasms and the blepharofacial spasms or the tooth grinding. Then the filler. These are the most commonly used, widely used the cosmetic product or the minimal invasive product, the filler. So what does fillers go in hand in hand? The filler is something that we use to fill the volume deficit. So if you have a volume deficit in your under eye, if you have a volume deficit in your cheek, if you have a volume deficit in your lips, we can use the filler to fill it. So there is a different type of fillers. Basically come with a hyaluronic acid compound. So that is how it acts. So if there's the gutter or the hollow, you can use the filler underneath like a support to lift up the tissue. So that is the basic physiology or the action. So fillers can be used again in the areas like smile lines, chin, lip, under eye areas to get the filler and fuller effect. The filler comes with hyaluronic acid, so it absorbs the water in the body, so it swells up. So it action enhances after injecting as well. So the uses of fillers, we can use the fillers for the smile lines correction, can enhance the cheek, to pump up the lips, get your chin more prominent, get your jawline contouring, and if there is a facial asymmetry, you can use the fillers to get the symmetrical face, which is called the facial harmonization. The fillers are basically the hyaluronic acids. About 80% of fillers are based on the cross-linked hyaluronic acid in a different thickness, or the polymethyl methylate, PLLA, calcium hydroxyapatite, and collagen. So usually PLLA and the calcium hydroxyapatite fillers are used in the deeper layers, but in superficial layers in the face, we use the hyaluronic acid. Right. So this is how I do the fillers. This is the under eye filler. We use the cannula. We just inject the gel in the subdermal areas. So filler comes in a syringe. Already the filled syringe, so we can use the number of syringes depending on the situation. And this is for the smile line, for the nasal area. So injecting the filler should be very careful with not injecting into the vessel. Because injecting into the vessel, there will be an embolization. So always, especially injecting the nasal area, there are facial lesions around there. Be very careful. So the indications, you can under eye fillers again can be used in the male and female both. We can use the fillers for the lip enhancement. Or can use for the fillers for the nose to get a bit of a sharper nose. Other than the surgical rhinoplasty, we can use the fillers to enhance the nose, but this is not permanent, it's a temporary. In the males, we can use a filler for the jawline contouring. So a lot of complications of fillers. This is bit of a more than the Botox. It can be our bruises and the hematoma. If you're not using the correct aseptic technique, there can be an infection because we're injecting the foreign body. There can be infection and abscess formation. There can be scarring, and they can be block the blood vessels and the embolization. If you are injecting for the facial, the injecting into the face, be very careful. So these are the downloaded pictures that I get it from the complications of fillers. If you are not doing it properly in the nose, it can be thrombose the vessel, can have the problems of the fillers. But again, it should be safe in the experienced hands. The next one is the threads. So the Botox filler threads is a common terminology going in the cosmetic, the medical treatments. So it is like again the reabsorbable polydioxone, PDO threads in the different gauges we use under the skin uh, to lift the tissues, stimulate the collagen, give you the volume. So it gives a lifting effect. It's some threads give the volume enhancement, or some threads give the collagen stimulation. Again, the threads can be used in the different indications like lines, crow's feet, nasolabial, smoke lines, for the neck lift. So there are the three type of threads we usually use. So the smooth threads which give you a volume enhancement. So again, multiple large number of threads on the skin, it gives the volume. The twisting threads again, like it filling and give the volume. But in the barb thread, or the threads like the small barbs, it is a lifting thread. So the commonly used threads are the barb threads. So they have like a fish hook like thing that it will adjusted to the skin and the dermal structures, and just give you a lifting effect. These are the spiral threads again, give you the volume. I'm not giving the of technical details of these threads. These are monothread or uni threads that you use the multiple number of threads under the skin, because it's a foreign body which causes the reaction of the scar formation under the skin, give you a more tighter skin. So this is the barb thread that you use. Just get the lifting effect. So it's tunnel under the skin. They have a little bit of a fish hook like uh, thing in the thread, which caught the tissues and lifting up. So it comes with a cannula. So we just tunnel the cannula and just pull it out the cannula, so thread is inside. So these are dissolvable. It lasts for about 1.5 to 2 years. Then we cut the edges. Right, again, the threads can be used to get the enhance the nasolabial and the lifting effect of the face, which lasts for about 1.5 to 2 years. So the complications again can be asymmetry, it can be dimpling. If you have tunnel to the different planes, they can damage the facial, the sensory nerves of the face, and sometimes can be develop the foreign body reactions. The lifeline is again to reduce the amount of fat. Sometimes the people have a chubby cheeks, which is they want to reduce the amount of fat, especially in the buccal area and the submental or the double chin area. So we can use the deoxycholic acid compounds to reduce the dissolve the a little amount of fat. So other than the filler, some people say we don't want to inject the filler or the artificial thing in your body, my body. So there is the natural filler, which is called the fat. So it is called the liquid gold in these three medicines. So we can use the different strength of the fat, which is called the millifat, the microfat, or the nanofat, to enhance the fill the different areas. So you can use a fat for the nasolabial area, other than this surgical one. So this lasts longer. It lasts about 5 years, 10 years. Something. The fat is glow. It's a glowing cell. We inject the glowing cell, so it glows. Or even the fat can be used to fill the lips. Right. So other than I told you that we can reduce the facial fat by using the injections, but if you want, you can just surgically remove the facial fat using the buccal incision. We call the buccal fat removal. Will give a bit of a more sharper the cheeks. So in the young people, sometimes if you have a chubby cheeks, they look have the hollow cheeks. We call like a fox shape, right? So if you want to get the fox shaped cheek, then we can reduce the amount of your buccal fat surgically. You can use the chin again can be filled with the fat other than the filler. Right. If you want to have the pure surgical outcome, like a surgical facelift, rather than this type of non-surgical thing, that you can use the surgical facelift by doing the surgical face and lip lift. It can reverse the age as well. So this is the how it comes like after the facelift. If you're not willing to get the surgery, there is a technique that laser also can be used to tighten up the tissues. We call the laser facelift or the 4D facelift. So we use a photo now, a different type of the laser technique. Again, we tighten up the tissues inside the mouth as well as outside. So these are heating up the tissues through the buccal cavity using the erbium laser. So this is again the laser is used for just to remove the skin pales, basically for the treatment definition, as well as the tightening of the tissues. These are the fine lines. So with the photoner, we can use this type of a effect for give you a bit of a lifting effect in the face. And then we came to the end of the presentation. So we do I think I give the broad knowledge of what is the techniques that we can use the anti-aging or the age reversing protocol or treatments that we can use. So I welcome if any questions or anything I can answer.